Good evening. My name is Miss Kelly, and I'm going to be educating you about the renal panel. If the kidneys are not functioning properly, waste products can accumulate in the blood and fluids, and fluid levels can increase to dangerous volumes, causing damage to the body or a potentially life-threatening situation. Renal panel may be used to evaluate kidney function to help diagnose kidney-related disorders. Renal renal function blood tests includes the BUN, the creatinine. The creatinine is a test product that comes from the normal wear and tear on the muscles of the body. Creatinine clearance test compares the creatinine in a 24-hour sample of urine to the creatinine level in your blood to show how much waste products the kidneys are filtering out in each minute. For the next lab is the albuminuria. This is a more sensitive dipstick test, which can detect a tiny amount of protein called albumin in the urine. The next test is a blood urea nitrogen BUN. BUN is used. BUN comes from the breakdown of protein in the foods you eat. A normal BUN level is from between 7 and 20. As the kidney function decreases, the BUN level rises. The next test is a glomerular filtration rate. This test is a measure of how well the kidneys are removing waste and excess fluids from the blood. It is calculated from the serum creatinine level using age and gender, with adjustment for those of African American descent. The normal value of GFR is 90 or above. A GFR below 60 is a sign that the kidneys are not working properly. The next test is a calcium blood test that measures the amount of calcium in your blood. Calcium is one of the most important minerals in your body. The next test is a potassium blood test. A potassium blood test is often included in a series of routine blood tests called an electrolyte panel. It measures the amount of potassium in your blood. The next test is a phosphorus test. Phosphorus testing may be performed to measure high or low levels of phosphorus to determine a variety of differential diagnoses such as dehydration, renal disease, liver disease, or diabetic ketoacidosis. The next test is a glucose test. Glucose blood sugar level is the most direct test to discover diabetes and may be used to identify diabetes, but also to evaluate how one controls the disease. The next test is a bicarbonate. A bicarbonate is an electrolyte, a negatively charged ion that is used by the body to help maintain the body's acid base pH balance. This test measures the total amount of carbon dioxide in the blood. Measuring bicarbonate as part of an electrolyte or metabolic panel may help diagnose an electrolyte imbalance or acidosis or alkalosis. And that includes my teaching on the renal panel. Thank you.